Welcome to the Nottingham Clinical Research Podcast. Our podcast brings you bite-sized updates on clinical research and related stories from the research we do at Nottingham University Hospital's NHS Trust and in our world-leading centres of excellence. I'm Ian Kingsbury and I work in communications for NHS East Genomics, and I'm based in the research and innovation team. It's my pleasure to introduce our latest podcast bulletin. You'll find a link in the show notes for more information on pretty much every item. So, here we go.
Depression and anxiety are the most common mental health disorders, with 1 in 3 people experiencing one of these conditions during their lives. These conditions impose a massive burden on societies. However, a major piece of research called the GLAD study has now recruited over 30,000 participants. Nottingham University Hospitals is one of the sites across the UK running GLAD, which stands for Genetic Links to Anxiety and Depression. The aim is to gain a better understanding of these illnesses and to work out which treatments work for whom and why. From April this year, recruitment into GLAD opened to participants without a history of mental health conditions. Joanne.Llewellyn, Clinical Research Team Leader in R&I, is one of the team involved in recruiting people into this research in Nottingham. She is urging more colleagues at NUH and members of the public aged over 16 to join the GLAD study.
We would be really grateful if you could take part in GLAD. If you do so, you'll be making a unique and valuable contribution to health research in the future.
Have you or a family member ever had a hospital-acquired infection or at risk of an infection due to another health condition, particularly if you've experienced pneumocystis pneumonia, also known as PCP? The clinical biology team at NUH are developing a new test to understand the spread of infections in hospitals. If you are interested in contributing to the development of this research proposal, please contact Vikki Flemming. Her email is in the show notes. Nottingham University Hospitals, alongside Nottingham Trent University, are carrying out research to design a new chest drain funded by the NIHR. A chest drain is a plastic tube used to remove fluid from the lungs in people being treated following an accident, surgery, or to relieve the symptoms of infection. It helps them breathe more easily by draining away fluids such as water, blood, and pus. Through research at NUH and Nottingham Trent University, they'll develop a new chest drain, one that cannot be accidentally pulled out or moved out of position, as this is the problem with the current chest drains and can lead to serious medical issues for the patient. The team would like to understand more about your experience of having a chest drain fitted as part of your care. To take part in this, you must be over 16 years old. You will be invited to workshops to discuss this research and take a look at different ideas to improve the design of chest drains. So if you or someone you care for has had a chest drain fitted as part of their treatment, please email getinvolved@nuh.nhs.uk. This email will also be in the show notes.
Many staff at Nottingham University Hospitals have come forward to take part in a national research study that will pave the way for a greater understanding of diseases that affect millions of people in the future. The NIHR BioResource is still open for volunteers to participate. Everyone who gets involved, which has so far included NUH's CEO Anthony May, other board members, and many other staff, will be making a unique contribution to the search for better diagnosis and treatment into a range of common and rare diseases. We're hearing again from Joanne.Llewellyn, who says taking part in this BioResource study is easy.
We've got quite a few staff involved. We would obviously like quite a lot more. We've also got quite a few patients involved as well. So the study is very simple. It only takes about 20 minutes to take part in. You'll be asked to sign a consent form, fill out a very short questionnaire on your lifestyle and also your health, and then also be asked to provide a very small blood sample as well. If a blood sample isn't possible, you can also give a saliva sample too.
Samples taken from NUH staff, together with linked clinical and demographic information, will be available for future research projects. The NIHR BioResource is capturing the DNA of both healthy volunteers and of people with a diagnosed condition. Jack Squires, clinical research team leader, says there is still plenty of opportunity for staff and members of the public to make a difference by contributing to the BioResource.
I just encourage anybody that's interested in taking part in science to take part. I think people feel that, particularly if they haven't got any health conditions, that there's no benefit to taking part in research, but control groups are hugely beneficial, particularly when you're looking at genetics. You need a comparison to find out why people are getting diseases and find the reasons for it and find treatments. So anything you can give will help, and help in a big way.
Constipation can seriously affect the health and quality of life of some children, young people, and adults. Management of the problem is historically difficult, as it is mostly based on symptom reports. Knowing how long it takes for food to travel through the gut could help clinicians direct treatment. A team of healthcare professionals at Nottingham University Hospitals and the University of Nottingham want to design an accurate and objective way of measuring gut transit time to help doctors make a faster and more informed choice of treatment. This could help speed up treatment and improve outcomes for patients. To do this, they'll need to understand the experiences of people who experience constipation. If you would like to get involved, you'll be able to support this research in a number of ways. You will attend workshops with other patients to discuss how the research is designed. You will complete surveys relating to your experience that will inform the design of the study. You will help to ensure the research is accessible to patients experiencing chronic constipation. To find out more about this opportunity, please email getinvolved@nuh.nhs.uk.
Thank you for listening. We hope you found something of interest. If you did, then please subscribe, rate and review us so that more people can find out about clinical research. Goodbye from me, Ian Kingsbury, and don't forget, you can find more information about our research and how you can take part on our social media channels and our website. This podcast is written, produced and developed by the Research and Innovation team at Nottingham University Hospitals NHS Trust. Follow us on @ResearchNUH, @NOTTMBRC and @NOTTMCRF, or visit nuh.nhs.uk/research.